Good afternoon. My name is Yoland Smith. I'm a professor and neuroscientist working at the Emory University in Atlanta, in Georgia, in the United States. It's a great pleasure and honor to be here today to talk to you about Alzheimer's disease and particularly the research aspect related to Alzheimer's disease. As the title of my presentation says, that we talk about some aspect of the cause of the disease, what happened in the brain of people who suffer of Alzheimer's disease, and also we'll discuss, some potential treatment and therapeutic which are being looked at in different laboratories. So before we talk about the main topic, I just wanted to give you brief idea. I think you heard about the introduction, but just going back a little bit to tell you, and this is also something important for me to be able to share with you, have this opportunity to share with you this knowledge about Alzheimer's disease, because really I'm from Gaspésie, so I was born in Newport here, a small village that you probably know of, and in fact, this picture, which is from the village, just from the harbor, in the village, and my house, my parents' house is right here at the top here. So which is, this is a very nice view of the harbor that we have, from our home. And I come back here every summer. In fact, this year will be the first summer that we did not come back. Even we have been in Atlanta for 25 years. And that's the first time, because of the pandemic, we could not come back this summer. But we come back here every summer for our vacation, and we clearly really enjoyed very much being back at home and enjoy the beauty of the Gaspé area. So just to give, and going back on my academic journey here, where I come from and how I got there to Atlanta. So I did my college degree in the au Cégep in Gaspé Cégep, and then I went to Laval University. So we spent quite a bit of time in Quebec City. So I did my bachelor degree there in biology, and then I did my master and my PhD in neurobiology. And after that, I moved to Oxford University in England, where I went for a few years of postdoctoral training to gain really some new approaches and different techniques to build myself a strong foundation for my research. So I did that in Oxford, and then I went to Johns Hopkins University in Baltimore in the US. And after Johns Hopkins, I came back to Laval University as a professor at that time. So this was in 1991. I came back there for 5 years until 1996. And this is in 1996 then that we have received an offer by Emory University in Atlanta to join the Department of Neurology there and the Yerkes Non-Human Primate Research Center. So we have been, my wife and I moved to Atlanta in 1996. So we have been there since almost 25 years. But as I said, I come back here, every year, and clearly Quebec and Gaspé area, this is really our home. We work in Atlanta, but our home is here and in Quebec City. It's a great, I'm very pleased that we have been invited to give this presentation. I really thank the Société d'Alzheimer for Gaspé-les-Îles for inviting me. It's a real pleasure, and I hope that you will enjoy the journey that I'm going to bring you through, talking about this very devastating disorder. And so let's see how we can approach that. How do we talk about Alzheimer's disease? So I think the first thing I did here is to put this slide, which is very busy and a lot of words, and I understand that, but I think it's an important definition because a lot of information is in this definition, and we'll go through each of those as we move through the presentation in more detail. So Alzheimer's disease is a chronic neurodegenerative disease. So that's something that we'll talk about. What does that mean, neurodegenerative disease? Obviously, there are many brain disorders, many brain diseases, but this is a group. There is a group of disease which are called neurodegenerative, where the brain essentially degenerates. And Alzheimer's is one of them. That usually starts slowly, which is also very important, and gradually worsen over time. So very long-term process. So it's not a disease that starts overnight. It takes years and years and years as the brain degenerates to see the symptoms appear gradually, okay? It is the cause of 60 to 70% of cases of dementia. So we'll talk a little bit about what we mean by dementia versus Alzheimer's disease. And we'll discuss those. But clearly, Alzheimer's disease is the most common cause of dementia that exists. The most common early symptom is difficulty in remembering recent events. So people have some problem with memory. As the disease advances, symptoms can include problem with language, disorientation, mood swing, loss of motivation. At some point, as the disease becomes very severe, not able to manage self-care and behavioral issues. So people need really care from others at all times. In most cases, the cause of Alzheimer's disease, like it is for most of these neurodegenerative disorders, is not known. We don't know exactly why people get Alzheimer's disease, so which is a big problem for this kind of disorder. As of today, there's no medication that can prevent or decrease the risk of Alzheimer's disease, which is also why these disorders are very devastating, because there's not much you can do to really stop that from, to really prevent it, essentially, people not getting it. And when it's there, it's today, at least as of today, it's impossible to stop it. On the other hand, this is where the research is going on. There's a lot of research, and the hope is that at some point we will have a way to prevent this disorder from happening. So let's talk a little bit about neurodegenerative diseases, what we mean by this. And I think, there are many diseases that I'm sure you have heard about that are part of this group. The categorization of them mean essentially, as the term said, degenerative, mean that there is degeneration of the brain, okay? So there are neurons, there are cells in the brain that die for reasons that we do not understand. And one that is very common that I'm sure most people have heard about is Parkinson's disease. So Parkinson's disease is one of these diseases which lead to the loss of specific cells in the brain that uses a neurotransmitter, a chemical called dopamine. Okay, so it's a very specific target, okay? And by losing these neurons, then the problem with people who suffer of Parkinson's disease is a loss of motor problems. So they have a hard time moving around, they have some tremor, so they have a lot really, and obviously that the disease worsens over time, and it becomes at some point very difficult for them to move at all. And you can see here, so here these are slices of the human brain, okay? This is a normal brain, normal individual. And this is an individual who died and had Parkinson's disease. So it's pretty obvious, I mean, when I talked about the cells that die here, so if you look at these cells here, so this is a group of cells, these are very dark neurons. So these cells are completely gone in the brain of someone with Parkinson's disease. So these are the neurons that I mentioned here use dopamine. So these are the cells that they generate in the brain of those individuals. And because of the loss of these neurons, this is what happened. This is the kind of problem that people will have with Alzheimer's disease. Another disease that we may not have heard as much because it's not as common is Huntington's disease, which is another one that leads to neurodegeneration. Some parts of the brain die, and you can see here by looking at these slices of brain from a normal person and from a person that died with Huntington's disease, you can see that there are large cavities in the brain that are very, very large. That's because part of the brain have died, essentially. And it leads to loss of neurons in different brain regions here. This is the name of those brain areas. It's not very important. And this is a very devastating disorder as well. So Huntington leads to motor, but also major cognitive and psychiatric problems. In case of Huntington, the cause is purely genetic. So that's one of those diseases which is due to gene transmission. There is a mutation, a change in the gene, in the family of people who have that, and it's going to be transmitted, from generation to generation, which is not the case for Parkinson or Alzheimer's disease. And here is Alzheimer's disease. So Alzheimer's disease, this is the one we're going to talk about today in more detail. You can see here, Alzheimer's disease is also very devastating. And the brain, you can see that the brain here of someone, a normal individual, and here is the brain of someone who died with Alzheimer's disease. So the disease will lead to a profound degeneration of the brain, which indeed will result afterwards in major, what we call cognitive deficits. So this is the problem with memory, personality changes, everything that we think about cognition. And we'll talk a little bit about the pathology of the brain afterwards. So as I mentioned here, there are some aggregates, the abnormal aggregates of protein that form in the brain of this individual. And this is really what causes the disease. This is what invade these aggregates, invade the brain of people, and it creates all kind of problem with the neuron, with the cells in the brain, have a hard time to communicate between each other. And this is what really lead to the cognitive deficit that we talk about here. The cause as well, why that happened, is not known. So we simply don't know. There is ideas, hypotheses there, but we do not know the cause, and that's why we cannot, prevent it from happening. The other thing about this disease, like Alzheimer and Parkinson in particular, these are diseases of aging, okay? So we'll talk about the main risk factor, and the main risk factor for the disease is as we get older. As we get older, we have more chance to get those diseases, okay? And here the slide says the dementia epidemic. It's a big problem in the society, for the world, across the world. It's everywhere in the world. And the reason why we talk about epidemic is because we live longer and longer. So there are more and more people who can live longer because medicine is great and we all live, many people can live very old. On the other hand, which is great, but on the other hand, the problem is that as we get older, the brain is not able to follow this old age. And there are more and more people who, unfortunately, as the brain gets older, then will become affected with these diseases. So you can see here the case of dementia worldwide. You have today, this is where we are. It's in millions, okay? And then as we move forward, the estimation in 2030, 65.7 million. In 2050, 115.4 million. Obviously, this assumes that we do not have any therapy that can prevent this disorder from happening. And clearly this comes with cost. I mean, these are very costly disease for the society, for the people who are affected. I mean, this costs a fortune. And in fact, if you look at the estimated cost, your annual cost for the cost induced by dementia, really $315 billion worldwide. It's more expensive than heart disease, cancer, and stroke combined. So these are very expensive because these are diseases also that last a long time, and the people are affected for a long period of time. So I've talked about Alzheimer and I've talked about dementia. So let's try to make sure that we understand what these two terms mean. In fact, as I mentioned at the beginning, Alzheimer's disease is the most common cause of dementia. But dementia can be induced by different problems, not only Alzheimer's disease. So dementia is what we call that an acquired condition. So this is something that will happen. People will eventually start having symptoms of dementia. And as I mentioned at the beginning, they can be very early symptoms and usually really some cognitive changes, memory problem, and so on, which will worsen and worsen. These are symptoms that persist in a sense that this, to be considered as dementia, it's not like someone will have a very temporary loss of memory and because of, for different reasons, can be medication, can be really brain trauma, whatever, and then it come back. No, usually with dementia, it is going to stay there and it is going to get worse and worse as the time go by. It's not a temporary confusion. And eventually when it gets severe, then it obviously is going to interfere with the normal life of people affected. Okay, at some point you won't be able to continue working. People will have a problem to be in group, will have a problem to interact with the society. So this is when you need, some help from the family support and also from occupational really help from people, from specialists and professionals in the field. And to be considered dementia as well, you have to have two of these problems here that are all related to cognition. Either memory, problem with language, having a problem to remember words that you normally use, problem with learned motor skill. At some point, people have things that they were normally doing very just really without even thinking, start having problem to remember how to do that, very basic things. Visual spatial abilities, problem with orientation, they don't know where they are, they have a problem to find themselves around. Executive function, problem to be able to stay focused, be able to maintain really complete really task as they become more and more complicated. And that come also with problem solving abilities and also personality changes. Obviously, all this come and people are not the same. These are not the same individual that they were before the disease. So these are, as you can see, very complex disorders that involve a lot of complex function in the brain, and that lead to these major, really, cognitive impairments. The dementia, as I mentioned at the beginning, is not something that starts overnight, okay? It's a long process. And when I mean long, I can say that maybe it can take really 20 years. The disease can install itself in the brain of someone before the symptoms appear. It can take 10, 15 years before any symptom will show up. But during that time period, the brain starts showing up the pathology of the brain, and then, it starts showing up the pathology, and the symptoms will come in much later. So that's why here you can see what you see on that curve is the progression, of the loss of cognition, change in cognition with age. Okay, so here you have really going from 45 to 85 years old and so on. And as the curve here, you can see up to 70 years old, things are okay. So that's what we call the preclinical stage, that there are some pathology in the brain, but no major deficit, no problem. But then suddenly the cognitive problems are going to start, and they're going to get worse and worse and worse, and then we call that mild dementia, when the problem are relatively mild and people can still function on their own. But then it starts becoming worse. You have a moderate dementia. Okay, the memory problem are more severe. People have started having problem to do things, and they need support from professional. And finally, then you can get to the level of severe dementia, where people are not able to function on their own. So they need help all the time. Their cognitive functions are completely lost, and they are essentially dependent on others to live. Obviously, that has a dramatic effect on the quality of life of the people who suffer the disease, but also of the people who live with those individuals. But that's a lot. That the point here is that this is something that takes a long time, and these are very long process disorders. And you can see here at the top an example about what the brain looked like, a schematic of how the disease progress. Okay, so you can see that the brain here is intact. Even with mild Alzheimer, the brain already is quite severely affected. Okay, but the symptoms are not. So the brain is able to compensate, and the symptoms are not that bad at that stage. But the brain is already severely affected. And then when you get to severe, it's even worse. And then you have all these very severe symptoms. So this is a slide here just to tell you a little bit about that. Alzheimer's disease is the most common cause of dementia. So here the blue pie, the part of the pie which is in blue, this is Alzheimer's disease, okay? And there are other forms here other disease that cause dementia, okay? You can see that there are, it's about maybe 30% of that are non due to Alzheimer's disease. And Parkinson is one of them. Parkinson can cause dementia, but there are other disorders that are mentioned here. But they account for a relatively small proportion compared to Alzheimer's disease. So Alzheimer's disease is really the most common cause of dementia. So age is very important. So age is the main risk factor to contract Alzheimer's disease. And this is shown in this graph here. So you can see the percentage of people who will be affected with Alzheimer's disease, over time. So people between 65 and 74, this is really around below 10%. So it's relatively small, 3% here. As you get older, between 75 and 84, then it gets up to about 20%. And over 85, almost 50% of people can be affected with Alzheimer's disease. So this is huge. This is a very large proportion of the population. So that's a disease. That's why, when we talk about epidemic, living up to 85 years old these days is quite common. Many people live that whole. So that means that that's why worldwide, there's a lot of people, unfortunately, who will somehow be affected to a certain degree with those type of dementia and disorders. So where does the term Alzheimer's disease come from? So this slide here is showing you a little bit of history about why it is called that name and where it comes from and what is the pathology. So the name comes from this gentleman here, which is Alois Alzheimer, who lived in 1864 to 1950. So Dr. Alzheimer was a neuropathologist and a psychiatrist in Germany. And he worked in Frankfurt, in Germany, in the mental asylum there in Frankfurt. And this is where he came across the first case of Alzheimer's disease. And his first case was this lady here, which is called Auguste Deter. So she lived between 1850 and 1906. So she was admitted at this asylum where he was working, and he was the psychiatrist who followed her. And he noticed, the problem that she had: memory loss, language problems, she had delusions, and she was showing this progressive decline in function. So finally, she entered there. She died in 1906 at the age of 55. And following this case, this is where Dr. Alzheimer really described this particular disease, and then also look at the brain of this individual. And he described also the pathology of the brain, that there was something in this brain that had not been seen before. And we'll come back on that. And there is a video that I will show you that will explain to you what is this pathology. Essentially here, the term of those are plaques and tangles. So here is a slide of a piece of tissue, of brain tissue, okay, from the brain of Auguste Deter, and also anybody who suffers of Alzheimer's disease. And you can see two types of pathology here. One of them are those big yellow, what we call the plaque here. So there are those aggregates that form in the brain. These are the plaque. And there is also those tangles, which are shown here, that will essentially integrate the nerve cells, and will disrupt completely the morphology and the function of these cells. And altogether, the plaque and tangles will invade the brain of people who suffer of that, and will cause a complete disruption of brain functioning. So this was described first by Alzheimer in 1907 as the main, and then this was associated with this problem here, this pathology, and this is known today. This is the pathology of Alzheimer's disease. So every patient who died and were diagnosed with Alzheimer's disease, they will have in their brain this pathology. This is what you need to have to be considered as Alzheimer's disease. And clearly, this is very important. This is why people have this problem. So the research, you can imagine that what the research is doing today is to try to remove this from the brain, or try to prevent that from happening in the brain, because this is where the problem is. So we know what the pathology is. It's not a problem. When I say we don't know the cause, we don't know why it happened, but we know what is going on in the brain. The question is why it happened and how can you remove this thing from the brain of individual who are affected. So that's really where the research is going. And here is just another picture of this. So, and I will show afterward the video about that. So you can see that there are what we call these, this is a section of a brain of someone with Alzheimer's disease here. And you can see with this kind of brown arrow, these are the plaques. These are those brown aggregates here of plaques that you will find throughout the whole brain of these individuals. And in more purple here, you have these tangles, which are really smaller processes that in fact will go into the cell, into the nerve cells, and will disrupt, the functioning of those cells. These plaques are made up of a protein that we call amyloid plaques. So these are the plaque of amyloid. And the other one in the tangles are made of another protein called tau. So amyloid and tau are two proteins that are present, in the brain that are somehow mishandled in the brain of people with Alzheimer's disease. And this is what creates this pathology. And as you can see here, just talking about the progression of the pathology in the brain. So here you have slices, sections of brain of individual at different stage of the disease. So if you go from stage 1 to stage 6, you're going from a very early stage of Alzheimer's disease to a very severe stage of Alzheimer's disease. Okay? And everything that you see in brown are these aggregates of tau, abnormal tau, in the brain of this individual. So what you can notice is that as the disease starts, there's very little of this abnormal tau located in this very specific region of the brain. But then as you progress, you can see that the tau start increasing, and then it gets more and more, and then it starts invading other regions of the brain. Finally, at the end, the whole brain is affected by that. So this is something that can go, and here you can think about from someone going from stage 1 to stage 6, there may be 20 years before you get to this level. So it's a long process. Okay, so here is I have a video to illustrate to you a little bit the what these talking about the tau and the amyloid protein. So this video explained very well about how this protein these aggregates form in the brain and what they do to the nerve cell to create the problem, the cognitive problem that we talked about. So let's watch this, and that will give you a very good overview of what is really going on.
Many people, as they get older, may notice changes in memory and thinking abilities. At first, these changes may be so subtle that they're easy to explain away as normal aging, and they may be. However, it's also possible that they're the earliest symptoms of Alzheimer's disease. Alzheimer's disease, or AD, is the most common form of dementia and accounts for 60% to 80% of all cases of dementia. In the United States alone, it is thought that one person develops AD every 66 seconds on average. In the early stages, people with AD may notice everyday tasks becoming more difficult to perform than before. Some typical early symptoms of AD you may notice include facing increased problems with memory, struggling to find the right words for things, becoming confused about time or place, having trouble managing money or paying bills, experiencing changes in mood, personality, or judgment, misplacing or being unable to find things. The symptoms of AD arise because of slow, ongoing injury to different parts of the brain. This injury, which affects nerve cells, is believed to be the result of two different processes that occur in the brains of people with AD. One involves a protein called amyloid beta, or A-beta, and the other involves a protein named tau. In the first of these processes, A-beta starts to collect inside the brain. This may begin as many as 20 years before the first signs of AD appear. A-beta is produced inside the brains of all people, but in healthy people, it is removed by the body before it can cause harm. In the brains of people with AD, A-beta clumps together in bigger and bigger groups and forms clusters known as plaques. As time goes on, plaques begin to form in more and more parts of the brain, which are responsible for learning, memory, and other tasks. The second process, involving tau protein, begins about 15 years before the first signs of AD appear. Tau normally plays a helpful role in the brain. However, in people with AD, tau becomes altered and forms tangles within nerve cells. Eventually, the processes involving A-beta and tau can injure nerve cells. As this injury affects one brain region after another, it leads to the appearance of symptoms you may recognize. AD is a disease that progresses over time, leading to worsening symptoms and can ultimately cause death.
So that gave you an overview about how these two proteins, which are mishandled, in the brain of people with Alzheimer, will eventually affect, the brain of individual and cause their problem. So why that happen? And this is a big question. That's an important one. Usually when you will ask about this disease, and that's not only the case for Alzheimer's disease, but also the case for disease like Parkinson's disease. When we think about what is the cause of this, people will talk to you about there is some form of genetic predisposition, because some people will get it and others will not get it. So there has to be some kind of gene that make you, it's like any other disorder, but there's no necessarily a gene that is specifically a mutation of a gene identified for most people. And an environmental factor. Environmental can be pretty broad, okay? So here on the right, what you can see on the right-hand side here are the, just put my laser pointer here, okay. So these are in red, are the cause, not the cause, but the main factors that are associated often with Alzheimer's disease, okay? Obviously, it does not mean that any of those people who may suffer of hypertension and so on are going to have Alzheimer's disease, but there is association between those two. Clearly, age is the most common one by far for any of these, okay? So age is as we get older, nobody, whoever you are, can say that they will not get those diseases. It's unfortunate, but that's the case. But clearly, like head trauma, people who, for instance, football players, boxers, there are really a good incidence of people who suffer of those diseases in them, where they have brain injury. Depression, hypertension is important. So clearly there is a vascular component associated with Alzheimer's disease. People have to be careful, taking care of taking care of your hypertension. That's very important to take care of that, because on the long run, this might be associated with, in some people, some form of Alzheimer's disease, which come with the ideas of heavy cholesterol. And there is also some ethnic differences. Clearly, like here in the African American, for instance, there is a much higher incidence of Alzheimer's disease in African American than there is in Caucasian people. There are other protective factors, really, that are, again, these are association, education, really, keeping your brain active is something that is very important. You want to try to be cognitively active, reading books, doing small exercise, anything that you can do to keep your brain busy cannot hurt. Exercise is also good. So physical exercise is good for any of those diseases. Eating well is important. Okay, and obviously it helps as well with avoiding and reducing this problem here. And statins that you find, this is some kind of chemical that you can find, for instance, in red wine, so having a little red wine may not necessarily hurt time to time. But anyway, so these are factors that are associated with it. And again, as I mentioned, it does not mean that people who have any of those are going to have Alzheimer's disease or are going to be protected against, but these are associations that have been made between the disease and these environmental factors. There is some form of disease, of Alzheimer's disease, that are purely familial, a little bit like what we discussed at the beginning about Huntington's disease, which is purely genetic. There are some family form of Alzheimer's that happen, that the people, the family members will be affected. They will have a gene that is going to be affected, and those genes have been identified. And this is what you can see here, the pedigree of those. So it doesn't really, it's not that important, but the idea is that these families are going to carry specific mutation that are going to be transmitted from generation to generation. These are early onset form of Alzheimer's disease. So people will start the disease, it's more aggressive, and they will start it a bit earlier than the normal individual who get Alzheimer's disease. The thing is that it's a very small percentage of people who get Alzheimer's disease. Less than 5% of the whole population will have this form of Alzheimer's disease. So it's not, so in general, that's why when we think about Alzheimer's disease, do we know the cause? No, we don't know the cause, because in those individuals, we know what it is that the gene is the cause. But for most people, it's not really. 95% of people, we simply don't know. The brain of those individuals are going to be similar to the people who suffer of Alzheimer's disease without the gene. So it's the same pathology. The difference is that it's more aggressive, it starts earlier, and clearly it does not necessarily, it's not present, it's not a common form of Alzheimer's disease. So how do we treat Alzheimer's disease? So right now, the treatment for Alzheimer's disease are purely symptomatic. So symptomatic, in a sense, what that means is that the doctor is going to try to give you some medication that will take care of your symptoms, depending on what kind of symptoms you have, what is really bothering you the most, which is affecting your quality of life the most. The doctor will try different drugs that are used for other diseases as well to try to help you. If you suffer of depression, if memory is very severely impacted, they will try to give you drugs that will help with that. But this is really symptomatic. None of this medication is going to stop the disease from continuing, and is going to slow down the disease, okay? So one common thing is what we call here, it's a chemical term, which is not that important, but it's called cholinesterase inhibitor. So the bottom line is that there is one neurotransmitter in the brain, which is called acetylcholine. So this chemical is very important to control normal cognitive function. So if you reduce acetylcholine in the brain, you will have some problem with cognition. And indeed, in the brain of people who suffer of Alzheimer's disease, the nerve cell that are the first affected are those that contain this neurotransmitter. So that's why the earliest symptom at the beginning, when the disease is mild and people have minor memory problems, at that time, their neuron that contain acetylcholine are dying, okay? And that's why they have this cognitive problems. So these neurons are very severely affected. And that's why what the doctor will say, they will use a drug that will try to increase the level of acetylcholine in the brain to help cognition. And it can definitely help some people to be able to have a better cognitive function when they take those medications. Obviously, very important as the disease progresses, caregiver support and education, family support, professional support. You need to really take advantage of the resources that exist, like what the society offers or others. I mean, you need to be taken care of. This is important. And this is the way that you will be able to continue that for advancing, and dealing with that disease. Keeping you aware, and education is very important. I think being aware of what the disease, the progress that happens, I think it's important to follow that. Unfortunately, where we want to be is here. We want to have a disease-modifying treatment. We want to have a medication that will slow down or prevent the development of disease. This is still not there. There's a lot of effort going on, and I will talk to that a little bit afterwards, but we still do not have any medication that will achieve that goal, unfortunately. So what do we do for that? What are the areas that people are exploring to try to find such medication? So as I mentioned at the beginning, the disease is a very long-term process, and it takes years and years. So what you want to do is you want to intervene early. You want to have some form of what we call biomarkers. How can we identify someone who have no problem, do not have any symptom of Alzheimer's disease, but the brain of this individual is degenerating. And eventually, as the brain degenerates, eventually the disease and the symptom will start appearing. But at the time that the symptom appear, the brain is already too heavily degenerated to be taken care of. That's the problem. That's the big problem, and that's the problem for all of those diseases, okay? So what we need to do is to try to identify individuals at risk for the disease. So how do you do that? Because the people have no symptoms. So you need to look in the brain. You need to have ways to identify those markers. And the way that people can find, I mentioned that what is the pathology of the brain? Pathology of the brain are these two proteins, right? You have those plaques and tangles that contain these two proteins, beta amyloid and tau, abnormal tau. So one way you can do what people are doing is that without necessarily going into the brain, you can collect what we call here the cerebrospinal fluid, which is a fluid that we have in the brain, which contain, a lot of the chemical that we have in our brain. So you can collect that by doing a spinal tap. You can collect this and measure the level of beta amyloid and tau in the CSF of individual. And indeed, there is a very good correlation between the abnormal tau and beta amyloid and the development and the progression of Alzheimer's disease. And you can see that here. So if people have a normal CSF, okay, then the chance of getting the disease, this is the blue line, is relatively stable. They don't show any Alzheimer's progression. On the other hand, if people have what we call pathological CSF, that means that they contain a high level of beta amyloid and abnormal tau, they will develop gradually Alzheimer's disease. So there is a very good correlation between the amount of this protein in the CSF and the chance and the development of disease. So these are biomarkers. This is very important. And this is heavily used today to screen large population of people at risk for the disease, to try and follow them over time and try to see if these markers will stand and be able to predict the development of the disease. The other way to look at that is to look in the brain. So we have some technique these days that allow us to visualize those plaques in the brain of people alive using brain imaging. So there are brain imaging techniques that you can see really even when people are alive. And this is an example. So what we're looking at, right, are these amyloid plaques. So this is this aggregate that you can see. So this is a slide, a piece of tissue from the brain of someone who died. But in fact, if you can use some imaging techniques, like here, you have brain of individuals with an early Alzheimer's disease. And the red here is indicating the beginning of those plaques in the brain of these people. So you see very little red, not much, okay, just in small areas. So that's the beginning. Then you can see that, in these people. As the disease progresses and the symptoms appear, now you start seeing more and more of those plaques invading the brain. And you have more and more red here. And finally, in people who are heavily affected, then the whole brain is affected by this. And the yellow here, the yellow is a very high level of these plaques throughout the brain. So these imaging techniques are very important because you can screen the brain of people and look at their brain and see the state of the development of those plaques in the brain. And you can follow them longitudinally over time and see how much progress these plaques. So this is a very good technique for what we call biomarker, because you can detect those in the brain of people who are alive. So the last part of it then is to try to think about what is done about trying to clear or try to attenuate this amyloid plaque in the brain. And this is what we would like to do. there was this paper, this scientific paper that was published in Nature, a very high-profile scientific journal in 1999, which was, we thought at that time that this was going to be the treatment for Alzheimer's disease, which was essentially developing a vaccine for Alzheimer's disease. So the question was, does anti-amyloid immunization, that means if you have a vaccine against amyloid, okay, will result in the clearance of the plaque from the brain of a transgenic mouse model of Alzheimer's disease. This was done in animal before going to people. So the data looked very promising. And you can see that here, just here is the brain of a mouse. So it's not people. It's a brain of a mouse, an animal model where you can induce the formation of those plaques. And everything that you see here is a mouse that has not received the vaccine. You see all the number of plaques here, like you would see in a person with Alzheimer's disease. But then if you immunize those mice against amyloid, you completely clear the brain from those plaques. So this looked really extremely promising. This was very positive. And indeed, following this, there were some clinical trials in individuals with Alzheimer's disease who received those vaccines. Unfortunately, the clinical trial did not had to be stopped because some individual involved in the trial, the patients involved in the trial, developed some side effects. And one of the side effects was in encephalitis, essentially. Some people developed encephalitis and they died following that, and they had to stop the trial during that period. So this was very disappointing because there was a lot of hope that was put into the development of this vaccine to clear, the amyloid plaque. It is still not something which is completely people have given up on, but it is something that they're paying attention to. Another example of study which is ongoing right now, which is to use, instead of using a vaccine, is using drugs that will reduce this number of plaque here. So there is a big clinical trial going on, the results should come out in 2020 by the NIH in the United States, okay? A lot of people are involved into this. And in that case, these are people who are old people, but people who do not necessarily have Alzheimer's disease, at least no advanced stage of Alzheimer's disease. So the idea is to start with people here and try to prevent them to go to these levels. So that's the way that they do that. So they treat the individual and they follow them over time, going from early, and the idea is to try to keep them at the early stage with the medication and see. So that's really one way that is going on, and that is the result of that should come out by the end of this year. So that's my last slide here, just to come back on these ideas about, so the take-home message is that in regard to treatment of Alzheimer's disease, early detection is the key for any treatment that we can think of about those diseases, okay? We need to be able to detect the disease early and intervene early. Intervening at that time here is too late. There's nothing we can do, unfortunately. The brain is already too damaged. You need to intervene here, okay? So here the only thing you can do is give symptomatic therapy. And this is what is done these days. On the other hand, if we could intervene a bit earlier, like here, with what we call disease-modifying therapy, we can change the speed of that curve and make it a little bit less, affected. People will stay healthy a bit more. Or even better, if we have a disease-preventing therapy, we could completely change the course of the disease and not have Alzheimer's disease and not have dementia. So this is really the goal of the research these days. And there is very active research going on. It's worldwide. And I'm optimistic that hopefully for both Parkinson and Alzheimer's that we will eventually reach that goal. It's not an easy one, but this is what we all hope that will happen eventually, and that we can take care of essentially preventing those disorders. Okay, that's the end of my presentation. And just to conclude, I want to thanks again the Société d'Alzheimer Gaspésie de Medellin for the invitation. It was a real pleasure and honor for me to share with you this knowledge about Alzheimer's disease. I also want to thank two of my colleagues here at Emory, Dr. Jim Law and Larry Walker, who are neurologists at Emory here with me, and also who are involved a lot in taking care of people who suffer of Alzheimer's disease. I borrowed some of the slides for this presentation. And also, this is my research team here that work with me at Emory University. So these are graduate students, postdoctoral fellows, technicians, and so on. This is my research team here at Emory University. They all really essentially do the work. And without money, we could not do anything. So we need to have funding to do this research. And the NIH, National Institute of Health, and is the main, funding agency for our work. So thank you very much. It has been a pleasure for me to share with you, and I hope that I will have a chance to answer any question you may have about this disease. Thank you.